Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine again. Welcome to our video series for parents. Today we want to talk about a concept that creates a lot of confusion for a lot of people, and that is the difference between various strains of a given germ and what that means clinically. And specifically we want to look at one germ, and that's Streptococcus, a bacterium, a series of bacteriums. And we want to look at the differences between group A and group B Streptococcus, and what exactly is the significance of that. Remember that these videos are not intended to replace visits with your doctor. If you have questions, please make an appointment to be seen. We'd be happy to see you at our office here at area code 775-359-7111, and we'll get you in same day. We really can't do telephone consults because that's bad medical care and really just not something that's ethical to deliver. But we'd be happy to see you here. So, what's the big deal with the concept of a strain? Well, it's kind of like the concept of an Italian. I'm an Italian, or I'm of Italian descent. So too is, or was, Al Capone, the gangster. I heal people for a living. He shot people. What do we have in common? Well, our families both came from similar regions in a country on the other side of the planet. That's about all we had in common. My family has no gang ties. He did. He's dead. I'm alive. Grew up in different parts of the country. I grew up on the West Coast. Capone grew up on the East Coast, and my family and his family have never met. So we have nothing in common. Other than that, the Capones and my maternal family, the Timpones, last names rhyme. Okay. Group A, Group B strep. What they have in common is that under a microscope, they both form, under a specific type of slide known as a gram stain, they form little black balls in chains. These little black balls are called gram-positive cocci, and they're in chains, as opposed to singular gram-positive cocci, as opposed to doublets, or double gram-positive cocci, or as opposed to gram-positive cocci in clusters. And that's really all they have in common. Okay? They are then subtyped according to some of the sugars that are found on their outside, and those sugars determine the disease process or disease processes that are available. So group B strep, and we'll start with group B strep, is really not a big deal unless you happen to be a child under roughly 2 months of age. For anybody over roughly 2 months of age, if we have it, we tend to carry it, and it lives on us and in us, in our mouths and in our genital tracts and in our GI tracts, and really doesn't cause a whole lot of problems, ever. When a woman is pregnant, the obstetricians test for this, however, because if mom is carrying this bacterium, we will treat her prior to delivery to protect the newborn. And then we watch the newborn carefully. In a child under 2 months of age, and definitely under 1 month of age, who has fever without source, we go on a hunt looking specifically for this bacterium because it is a bad actor. Causes pneumonia, meningitis, blood infections, shock, and death. And it is the most common infectious cause of death in a child under a month of age. But this bacterium has nothing to do with strep throat. Strep throat is caused by group A strep. Group A Streptococcus is another gram-positive coccus in chains, but does nothing like the group B strep. So it can grow in your throat and cause throat infections. We call that strep throat. Everybody's familiar with that. It can grow in the skin and cause cellulitis or an abscess. It can grow on the skin and cause impetigo. Rarely it can show up in the middle ear or the sinuses, causing middle ear infections or sinusitis. Rarely it can invade the brain and cause meningitis. Rarely it can invade the lungs and cause pneumonia. It tends to be more self-limited and generally not a real bad actor as far as a disease. There is, however, some weird immune reactions that can take place to group A strep that can go on to cause kidney damage or heart damage. But those are not from the disease itself, but rather the body's attempt to eradicate the disease gone bad. And so it's an autoimmune process. But the infections themselves tend not to be particularly dangerous, whereas group B strep is very dangerous. So why do I make this big deal? Well, one, I want a lot of parents want to be able to understand group B strep because they're told when they're pregnant they're carriers for it. We need to make a big deal out of this. And then when the children are older and they come in and we say you have strep throat, suddenly the doctors are a little bit more nonchalant and not making a big deal out of it, and that can cause some confusion. So I was hoping to be able to kind of separate that out for you. This holds true for other diseases as well. Viruses have multiple strains, some of which are bad actors, some of which are not such bad actors, depending on the individual virus. Human herpes virus type 6 causes a very mild viral rash. Human herpes virus or herpes simplex virus type 1 or 2 causes herpes as we know it, with sores on the skin that hurt like heck, fever blisters, cold sores, genital herpes. What do they have in common? Mostly what they look like under an electron microscope. Large viruses, double strands of DNA, single double strands of DNA as opposed to multiple double strands or multiple small strands. That defines a herpes virus. So I hope this helps to kind of just help this gel for you a little so that you understand why some things are a big deal and other things aren't. When we look at antibiotic sensitivities, those vary potentially within the group as well. And when we look at antiviral sensitivities, there's potential for those sensitivities to vary within the strain as well, or from one strain to the next as well. Perfect example is influenza type A and B. Type A is sensitive to an antiviral called amantadine, typically, and type B is not, ever. So distinguishing can be of value for us. So I hope this has helped to shed some light on something that creates a little bit of grief for a lot of people and make it not such a grief-stricken thing, because this is a common event for parents to run across. If we can be of assistance here, please give us a call at our office, 775-359-7111. We'll see you next time.